So the Free State is now among the provinces which have reported COVID-19 cases. Health Minister Zweli Mkhize was in Bloemfontein today, where he confirmed that 7 people have tested positive in the province. Free State Premier Ntombela has cancelled events including the annual Makufe Festival and National Day events, saying the budget will now be redirected to the efforts to fight the pandemic. To take us through the province's state of readiness for more coronavirus cases, I'm joined now by the Free State Health MEC Montsheng Tsiu. She's live to us from Bloemfontein via Skype. A very good evening to you, MEC. Thank you for being with us. I want to begin with this group of 5 people who were in the Free State for a church conference. They had travelled internationally. The concern there is about tracing their contacts. How far are you with that?
We are already on that. We started this morning, on tracing the contacts. We actually started going to them so that we understand the places they have been, the people that they met who might have been exposed to the virus. So we got all that information with us now, and then we will then start tracing them as from tomorrow.
And they'd been to France, Israel, and I believe the United States, all of them countries which have indeed recorded infections of COVID-19.
Yes, it's 2 from USA, Texas, and 2 from Israel, and 1 from France.
Where are these people now, MEC?
They are at one of the hotels in Bloemfontein, in Woodlands. They are quarantined there together with the staff members of that hotel and the manager there.
And speaking at the briefing today, the Premier Ntombela said, and I quote, "After seeing what has happened, I've realized our people in the Free State are in danger." A lot of the people in the Free State wondering then, watching this program tonight, how great a deal of danger they are in.
They are indeed in danger, but we are going to be able to help each and every one, because we're going to make sure that we close around all the contacts. Indeed, it will be a huge number, regarding the fact that these people went to a church not once but 3 times, and they have met lots and lots of people. The first time it was 300, and the other time it was 250 something, and then the third time it was still 300. And the fact that they did not just go to the church because they came to a church conference, they did go around some restaurants in Bloemfontein. And now members of the church would have gone home, met with their families. We need to go to each and every family of those members that were at the church. The staff at the hotel traveled in a bus, which then makes it difficult for us. They traveled, some of them from Botshabelo to Bloemfontein in a bus, and some with the taxi from the township to the hotel. That then would be a challenge, because those people would not know people that were with them. But because we will try and maybe try and locate these people, it might be problematic with that. But with the families, we are surely going to be able to trace that. We've got more hands. The minister today connected us with Red Cross. Red Cross is here with trained tracers that are going to help us trace all the contacts of these people.
Just on the contacts, I beg your pardon, MEC Tsiu, am I right in saying that you are looking potentially for over 1,000 people who possibly came into contact not only with the 5 people who travelled and then gone to the church conference, but also the hotel staff and the like?
Yes, we are looking way. It might probably be over 5,000, if I have to say so. Because remember, each person that has been in contact with these people, there are other people that have been in contact with that person. So we're looking around. Each person will then have a cycle of contacts. It will be the contacts with these 5 people, the people that they have met, the staff members, the people that have met with the staff members. So it's quite a huge number. It might be way over 5,000 if I have to estimate.
How then does a province such as the Free State, which is not wealthy, is not necessarily one that has been blessed with the most resources, even begin to potentially treat 5,000 people?
Well, because we are not alone in this war, National is supporting us. We are at the moment, apart from the extra pair of hands that we got from the help that we are getting from Red Cross, we have started with the employment of contracting workers, the nursing assistants, 1,000 nursing assistants. That would help us. And the accommodation, we are working together with the private. Today we spoke with the private facilities that are in Bloemfontein. That should there be anybody that would need admission and we need extra beds, then private would also help. The University of Free State we also met with them in the morning. They are also willing to also avail accommodation for people that might need accommodation for maybe not just treatment, but also for quarantine. So we are working with the...
I beg your pardon, MEC. I'm wondering if you are able at this stage to disclose the name of the church where people had gathered, or tell us if you've communicated to the church that these 5 people were among their congregants.
We have not as yet communicated with them, so I would not disclose the name of the church, nor even the name of the hotel.
Okay, let me talk to you about something else, because there's the Brandwag Primary School in Bloemfontein, a parent to 2 pupils, I understand, at that school, who's a health worker in the Free State, has now tested positive for COVID-19. Some of the children then at that school will also now have to be tested. How long is that going to take? Because there are about 600, I believe, children who go to Brandwag Primary.
We dispatched our team today. There was a team of workers, the health workers, that were the nurses that were testing, and in fact they were screening and testing those that needed to be tested today in Brandwag. I did not get the report whether they did finish the line of the people that were there. But if they have not finished, even tomorrow they will continue doing the test to those that they did not test, because the aim is to make sure that each and every contact is tested. So we do have enough staff, and we do have enough equipment for us to do the screening.
Last question, MEC, to you. Are you at this stage, given just the large number of contacts in the church incident alone, are you, as the Free State, worried about the province potentially becoming the epicenter domestically of this COVID-19 pandemic?
At this moment, we cannot say the whole province. We are worried about Mangaung as the region, because the workers that we're talking about, some of them are traveling from Botshabelo, some from Bloemfontein in the township, like I said. We are worried about Bloemfontein. If it gets to a push, we say there should be a shutdown. At the worst scenario, that is I'm painting, we can only say we shut down around Bloemfontein, not the rest of the province. Because at the moment, it's only Bloemfontein in the province that has got a problem.
And Bloemfontein, having come from the Free State and that city myself, we know in terms of health has had various problems. The Belonomi Hospital, which I know is one of the COVID-19 treatment facilities, the National Hospital, you think of the MUCPP health facility in the township. They've all had problems in the past, and the problem that it raises potentially is a confidence issue among Mangaung residents. How do you reassure them that as a government, beyond the deployment of resources, as a Free State Health Department, you are on top of things and that you will handle this as swiftly as possible to ensure that there's as minimal infection as possible?
We are on top of issues. I think the way we responded to the news once we discovered that we have positive cases then should bring confidence to the people, because we have at this point in time quarantined those people. We have started with contact tracing, and if there's anybody, and luckily none of these people that I've tested have tested positive, needed even an admission. We will be going out to trace the contacts, and we are saying those that know that they've been at the church. I might not have said the name, but they would know. People would know. They should come forward so that we do the screening and the testing. Their confidence should be okay, because indeed we are doing a good job. And as for those that would be needing admission, I must tell them at the center, the hospital that we had chosen for us to be taking care of these people, we have prepared everything that is needed there. So we will not really have a problem. We even have ICU beds ready. So and we have specialists. The university again said they are prepared to also give us more specialists to assist should we find ourselves overwhelmed with the number of patients that would be needing treatment.
Monseng, Free State Health MEC, all of the best. Thank you so much for being on Nightline.